Mr. President, like many others, on January 22nd, I spoke in this chamber about the earthquake that struck Haiti on January 20th and the unprecedented devastation it caused. Excuse me. We now know that an estimated 3 million people have been affected, including some 700,000 people displaced from Port-au-Prince and living under plastic or other makeshift shelter. As many as 200,000 more may have died. Tens of thousands have suffered injuries, including many whose limbs had to be amputated, some as the only way to save their lives and to extricate them from the damage. Hundreds of thousands of children have lost one or both of their parents. It is hard to quantify the scale of human suffering. Think of it, Mr. President, thousands of commercial buildings, 200,000 homes, the presidential palace, the National Cathedral, as well as the parliament buildings and government ministries, UN headquarters, are either heavily damaged or destroyed. Roads, ports, communication facilities, extensive damage. 90% of the schools in Port-au-Prince were destroyed. This rebuilding is going to take years, even with the help of the international community, the United States, the neighbor here in this hemisphere. Now, the generosity of the American people, as well as people from so many other countries, has been extraordinary. Hundreds of millions of dollars have been raised from private organizations, foundations, corporations, individuals, school children. There have been countless tons of donations of food, clothing, medicines, and other supplies. It's especially heartening to see the commitment and dedication of volunteers, many of whom, after they received word of the earthquake, immediately began to pack up to travel to Haiti to help in any way they could, not being absolutely sure what they might do or where they're going to be, but know that they had a skill and they're going to be there to help. And one such group is the Vermont Haiti Relief Team. It includes members of the Vermont Haiti Project and the Vermont Federation of Nurses and Health Professionals. They traveled to Haiti. I've helped with some of them. Talked with some of them in helping with the recovery. I've heard and read their stories. I've seen the photographs they sent back. Here's one photograph carrying out, obviously, a patient on a stretcher. Now, as a Vermonter, as an American, I could not be more proud of what they're doing and the life-saving work they are doing. Our little state of Vermont, as far north from as Haiti as it could be, we're right up there on the Canadian border. We answered the call immediately to come and help a neighbor in the hemisphere. On January 7th, 11 volunteer doctors and nurses and other health professionals from Vermont arrived in Jimani in the Dominican Republic. Now, that's a remote border town where some of the injured were taken from Haiti immediately after the earthquake, where many more have arrived. The Vermont health workers joined with other doctors and nurses to care for hundreds of patients in the hospital. They coordinated helicopter and ambulance transports. They established wound clinics to evaluate and treat injuries. They cared for over 250 amputees. They worked tirelessly to meet the needs of the victims and their families. And you know, what they did helped so immensely. But I look at just this one photograph. Look at his face in helping this child. Some couldn't speak the language. None of them knew the people before they came there. All they knew, they were fellow human beings suffering. And the sense that we have in Vermont and so many other places, if your neighbor is hurting, you're hurting, and you go to help the neighbor, and they went and helped. And it's life-saving work. But it's also life-changing work. These Vermonters are going to return having endured, improvised, but made a difference through the experience of a lifetime. How many of us can say we've done something to make a difference in someone's life? They have. but their own lives have been changed. They're confronted with hundreds of injured people. They had just a handful of medical personnel, no supplies. There was no 10 to 5 or 8 to 5. This was around the clock with volunteers from Haiti, Dominican Republic, and many other countries. Sometimes electricity worked, sometimes it did not. Death surrounded them. But many of those who would have died survived because of the care of these Vermonters. The team also traveled to Vermont, Haiti, where a clinic was established. They worked with Haitians and other relief organizations to create a wound clinic. And after 2 weeks of work in difficult conditions, the first team of Vermonters is coming home. They're exhausted physically and emotionally, but they're proud of the help they provided to their Haitian patients and being able to represent Vermont in the relief effort. This Vermonter is proud of them and proud of a second team that's now arrived in Haiti. It's already begun working. The Vermont Haiti relief team hopes to continue to send volunteers for 2-week rotations to support the hospital in Himani and the clinic in Font Parisien for the next 3 to 6 months. I've been there, Mr. President. I've been to Haiti. I know how the poor country it is. My wife, Marcelle, is a registered nurse, now retired. She's gone in those hospitals. She's seen how little there is to work. She knows what somebody coming with their skills, what a difference that makes, and with the international support, not only from our country, but from others, in bringing down the equipment that was lacking, the supplies was lacking, what a difference that makes. Marcel and I are very impressed with the commitment of these Vermont volunteers. This is not an easy job. This is an emotional, physically exhausting. But think what they have done. So I thank them for their hard work and dedication, for their selfless example. Mr. President, what happened in Haiti was as great a tragedy as any one of us will hear of. But what it has done is touch the generosity of people. We don't ask what their political parties are, what their race is, or where they're from. They all went to help. And look at this help. And the help has to continue. I will make sure, as chairman of the Foreign Operations Subcommittee, that our part, the United States, helps. But in Europe, in Asia, in the Middle East, in the Far East, people are helping. We must continue. But for this small group of Vermonters who went down there, lives were saved, lives were changed, children were rescued, and we Vermonters are proud.